Today on Investigate TV, medical tests denied before they're performed. Doctors say insurance companies get in the way, delaying diagnoses, and people are dying.
They failed her so miserably, and from beginning to end, she suffered for no reason.
Plus, medical professionals warn if you have an allergic reaction, plummeting blood sugar, or other medical emergency on a plane, responders may not have what they need to help.
100% of the times that I've asked for those kits, they were either absent or incomplete.
Investigate TV starts right now. Doctors say insurance companies are basically practicing medicine by deciding what gets covered and when, but aren't being held to the same standards, and patients have few options to fight back if delays affect their health, even if they go to court. We dug through dozens of insurance policies to look at the complicated system of pre-authorization. How long were you a cop?
Oh, 17 years.
17 in New York City?
New York City, yes.
Val Valentini took an oath as a New York City police officer to protect people and value human life. But when he asked his insurance company to provide the same type of care to his wife, he says it failed.
You know, and it's frustrating now. At the time, the anger was, I can't even explain it. You know, even on her part.
As Kathleen Valentini's hip pain worsened, doctors ordered an MRI to investigate a suspicious mass that turned up in an X-ray, but her insurance company denied it. So her doctor told her, I want you to get an MRI because I feel like this is what you need. And then the insurer, who never saw her, said, no, you're not getting it.
That's exactly it. And then when they denied it, again, they asked that she do physical therapy first.
But Kathleen had already done physical therapy, so her medical team appealed. Nearly 6 weeks later, Kathleen had that MRI, which confirmed she did in fact have bone cancer. But doctors told her the diagnosis had come a few weeks too late for the treatment to be simple.
They failed her so miserably, and from beginning to end.
The cancer was aggressive, a fast spreader. Doctors had to amputate her right leg, hip, and part of her pelvis. So the delay by the insurance company forced her to need amputation?
Yes, 100%.
How do you process that?
I can't. Because she suffered for no reason.
Kathleen's insurance plan required her physician to obtain prior authorization for the MRI, a process used by most commercial health insurance companies. It's when doctors submit a request to the insurance plan and it decides if it will provide coverage, often based on whether the company thinks the test or treatment is necessary.
Prior authorizations are dangerous. They were created to root out waste and inefficiency. That's not what they're doing. They're building the bottom line for the insurance company. And when you put profits over people, that's not right.
In November of 2020, Kathleen Valentini lost her battle with cancer. At the age of 50, she left behind her husband and teenage son.
It's unspeakable that insurance companies and their subcontractors in the name of profit can do this.
Is this all about profit?
I think so. I think so. That's the only reason for prior authorization.
It's all a roadblock designed to save the company money.
Justin Williams gave TikTok viewers a behind-the-scenes description of how he remembers the prior authorization process.
The whole prior authorization process is designed to take as much time as possible.
He worked for a major health insurance company for almost a decade, his team processing electronic faxes of requests from doctors as they came in.
So every one of those faxes coming in would be someone's hospitalization, somebody's medical equipment, somebody's
treatment.
Many states have laws for how long insurance companies can take to make a prior authorization decision, depending on the kind of request. Williams says over time, bosses pushed his team to focus on new and different duties. The queue of unprocessed fax requests backed up into the thousands, often pushing each prior authorization to the maximum amount of time.
It basically became clear to me that the primary function of the insurance company was not so much getting things done in a timely fashion.
Employees in departments like Justin's, those responsible for the first stage of processing requests, often aren't required to have any healthcare background at all. We found numerous job listings where representatives only need a high school diploma and customer service experience, and found online resumes of prior authorization employees whose previous work experience was listed as things like working at a hardware store or being a supermarket cashier, with education in areas like cosmetology or landscape architecture. Companies note these employees are not making clinical decisions, but some jobs include working directly with request case files.
I think we need to embrace all kinds of workers in healthcare, but it is important the level of experience and training that you have, and so we should have people acting appropriately based off of that.
Research shows the practices of physicians like Dr. Gabe Charbonneau spend around 14 hours every week on prior authorization paperwork and dealing with insurance companies instead of treating patients.
I actually think it is insurance companies practicing medicine.
He also says there are frequently initial processing mistakes, like not noticing things a doctor would, like denying a prescription only to suggest an identical drug.
My nurse actually brought it to me and she's like, am I reading this right? I mean, it was very confusing. It was like, okay, so it says the medication is the one that's denied. This is the medication that's recommended, but aren't they the same thing? And I was looking at it, I'm like, yeah, they're exactly the same thing.
Sometimes he even has to fight with doctors employed by the companies to try to get treatment approved.
It's hard to have your judgment questioned all the time.
Another part of what makes the process so hard to navigate for providers and patients, not all insurers have the same rules. We looked at the publicly available policies of nearly 100 insurance companies, trying to see if those insurers required prior authorization for some of the most common procedures and tests, things like CT scans, cardiac stress tests, sinus surgery, and knee replacement surgery. Prior authorization requirements for the same service varied company to company, and sometimes state to state. According to the standard policies published online, most patients who have Emblem Health coverage do not need prior authorization for a basic cardiac stress test, but those who have certain United Health plans do. Oklahoma Blue Cross Blue Shield customers need prior authorization for outpatient sinus surgery, but Massachusetts customers do not.
It feels like it's this roadblock that's intentionally put in the way that everybody has to deal with, no matter whether you're right or whether you're not right.
We tried to interview representatives from the insurance industry for this story. A political advocacy association representing health insurers refused to make someone available.
Health insurance providers use medical management tools to help patients get the right care at the right time in the right setting.
But in 2018 testimony to Congress, the group says prior authorization has been effective in addressing overuse and misuse of tests and procedures.
With prior authorization, our members analyze whether a treatment is safe and effective for a particular patient based on the best available clinical evidence. Insurance providers also ensure the treatment is provided in the most appropriate care setting by a qualified licensed provider, and it is provided with other needed services.
By making these decisions, people like Val Valentini and his attorney allege insurance companies are actually practicing medicine. The family even tried to sue their insurer for medical malpractice. But the case got dismissed because in New York, as in most states, there are no laws holding insurance companies to the same standard as doctors.
What they're doing is disgusting, and it's getting worse and worse, it seems.
Because while insurance companies say prior authorization benefits everyone, Valentini is left feeling like the system puts companies in charge of giving permission to practice.
You know, the insurance wasn't there for her when she needed it. So who's it helping? I don't know. It certainly didn't help us. It's certainly making the doctors' lives more difficult because It seems like the insurance companies are getting in the middle of doctor-patient. So who is it helping? I guess it's helping them.
You can find documents from the Valentini's legal case and more details on our team's research online now at InvestigateTV.com. Coming up, every year, hundreds of millions of Americans hop on flights. Mid-air medical emergencies are on the rise, but the federal government may not be doing all it can to ensure passenger safety. That story after the break. Welcome back to Investigate TV. Doctors across the country are sounding the alarm. On commercial flights, emergency medical kits are outdated and inconsistent. And we learned the rules that mandate what must be in those kits haven't been updated in nearly 2 decades. Rachel DePompa investigates.
I'm going to go ahead and declare a medical emergency as well. It's actually the captain that's not doing well.
A Southwest flight from Las Vegas to Columbus, Ohio.
So we need to get him on the ground immediately. So we are an emergency aircraft at this point.
The captain falls ill with stomach pain and faints. An off-duty pilot saves the day and lands the plane back in Vegas. From pilots to flight attendants and passengers.
Do you have any medical personnel on board?
Medical emergencies are on the rise as travel increases and the population ages. The Centers for Disease Control estimates about 1 in every 600 flights has a medical emergency. Doctors are warning when the call for help comes down the aisle, they don't always have what they need to help you.
100% of the times that I've asked for those kits, they were either absent or incomplete.
Dr. Leo Nisola is talking about emergency medical kits on flights. All airlines are required by the Federal Aviation Administration to carry these bags filled with 25 mandatory items to save your life. The kits include a stethoscope, aspirin, a blood pressure cuff, and epinephrine to treat allergic reactions, but not an EpiPen, in pre-measured doses, which makes the drug easier to inject. Neither the FAA nor Congress has updated what's required inside these kits for nearly 2 decades. Dr. Nisola's helped in at least 5 in-flight emergencies.
I think those kits are usually outdated, the ones that I've come across, and could definitely use some improvement.
First time I saw this kit, I was astonished that they did not have something as basic as a glucometer, which is a blood sugar monitor.
Dr. Amy Faith Ho works in a Texas ER and has helped with medical emergencies on multiple flights. She says some airlines are going above and beyond to add more items and medications to their kits, just not all of them. In 2020, the FAA issued guidance to airlines encouraging them to include more. It's still not mandatory to add the extra items.
Should this be better regulated? Should there be a uniform policy for all airlines and not airlines electing to do things or not do them?
But I absolutely think that this needs to be centralized and regulated in one place so that you can know what you might have on any given airline.
MedAir is a company that makes medical kits filled with more than the FAA requires. 16 airlines around the world use these kits, but not every U.S. airline. MedAir did not disclose which carriers are involved, but Alaska Airlines and Delta told us they use the kits. Dr. Paulo Alves is the company's global medical director. He led a 2019 task force created by the FAA to review what new items need to be in these kits. It made several recommendations.
The FAA is actually the governmental agency responsible for enforcing the medical kits and controlling the medical kits. But they don't define the content of the medical kit.
There's no government agency tracking all in-flight medical emergencies, so we asked the FAA for a list. The agency eventually discovered it does track some of these incidents. So we analyzed what it gave us and found more than 400 medical emergencies on commercial flights in the last 5 years. We found passengers falling ill, having seizures, a passenger with a broken leg from turbulence, a flight attendant inadvertently stuck with an insulin shot while trying to help a passenger with a diabetic issue. In a statement, the FAA told us it's reviewing the emergency medical kit requirements based on the input from this task force. Though changing the official list of requirements for these kits means Congress has to act. Until then, some of the emergency medical kits on flights continue to be outdated and inconsistent.
If you are a patient and you are traveling, please, please, please make sure that you keep any of your life-saving medications with you. Do not check it. Do not put it in your luggage.
Our national team reached out to 8 major U.S. airlines. All except Spirit responded, and all that responded said their medical kits complied with FAA requirements. You can read the full statements on InvestigateTV.com.
Thanks, Rachel. Up next, a woman in hospice care over-medicated and nearly killed.
We are watching a murder, and I'm not going to stand by and watch it happen anymore.
One person is in prison, but the family is fighting to hold a doctor accountable. That story after the break. Welcome back to Investigate TV. A woman placed in hospice care, but not terminal, given a lethal mix of drugs and nearly killed. A daughter was convicted, a doctor implicated. But how could something like this happen? Andy Parati breaks down this true life story that reads like an episode of a daytime soap opera.
Sheriff deputies and a county coroner respond to a home in 2017. They're told a woman inside, Shirley Couch, may just have hours to live.
Miss Shirley? Miss Shirley? Oh, you hurting, baby?
My mom's lying lifeless in a bed. She's in a coma.
Deputies in this North Georgia home find vials of morphine and bottles of antipsychotics in the room. Look at the coroner's face.
Oh, she's got a patch.
When she discovers someone placed fentanyl patches on Shirley, a powerful combination of narcotics usually restricted to patients shortly before death, all administered to Shirley, who was secretly placed in hospice care by a family member.
She's actually being overdosed.
Was your mom dying?
Absolutely not.
Christy Carr is Shirley's youngest daughter. What was she doing in hospice care?
That was my question exactly.
Who admitted Shirley into hospice? Renee Bonner, Shirley's oldest daughter, who worked at Homestead Hospice as an administrative assistant. Suspicious of her big sister, Christy called 911.
We are watching a murder, and I'm not going to stand by and watch it happen anymore.
In 2019, a judge found Renee guilty of attempted murder. In 6 years after the family was told their mother was knocking on death's door, Shirley's still alive. What did you think when you woke up from the coma?
I was so confused. I didn't know where was I at.
We visited Shirley this past February.
But to have your child try to kill you, that's hard to live with.
But that's not the end of the story. Shirley's family believes someone else is to blame for nearly killing their mother, someone who never met her. He's Dr. James Shiver.
No, I did not see her physically.
Seen here in a 2021 deposition, part of a recently settled lawsuit the family filed against the doctor. He's the former medical director for Homestead Hospice. In the deposition, Shiver claims he prescribed Shirley morphine, fentanyl, and other drugs, but only after consulting with nurses on the phone, caring for Shirley. According to court records filed by Shirley's attorney, which includes the doctor's Verizon call logs, Shiver and the nurses never spoke.
And this is an empty vial.
Okay.
Multiple requests for an on-camera interview with Dr. Shiver went unanswered, but over the phone, he denies any wrongdoing. Dr. Shiver claims he can't remember speaking with Shirley's nurses, telling me whether or not they were and when they were called, I don't know.
God is the only one that decides when it's our time. Because in my opinion, how's that any different than putting a gun to your head and pulling the trigger? They're just doing it with drugs.
While Shirley's family submitted a complaint to the medical board, the agency declined to confirm or deny whether it's investigating Dr. Shiver. But emails and texts our team reviewed between Shirley's daughter, Christy, and a medical board investigator show the agency is looking into a complaint filed by the family. Homestead Hospice was acquired by a different company after Shirley's incident. Its new owners declined to comment. Coming up, saving money for a house, wedding, maybe your child's tuition. But what about retirement health care? If it's not on your list, it should be. Hear why after the break. Welcome back to Investigate TV. Saving for health care in your retirement may not be top of mind, but experts say hundreds of thousands of dollars may be needed to offset costs. Rachel DePompa is back with some tips in this week's Watching Your Wallet.
Experts from Fidelity estimate the average 65-year-old retired couple in 2021 would need about $300,000 in after-tax savings earmarked just for health care costs. That's even with Medicare. It can seem daunting, but our partners at the financial website NerdWallet put a list together of strategies to help us prepare for that cost. Number one, take advantage of an HSA, also called a health savings account. It allows you to put pre-tax money away for medical expenses. Also, plan for long-term care. A person turning 65 today has about a 70% chance of needing long-term care at some point, according to the Department of Health and Human Services. This could mean buying a traditional long-term care insurance policy, which can cost thousands of dollars per year, according to the American Association for Long-Term Care Insurance. You could also set aside money annually for long-term care expenses to kind of plan for it. You want to get the right Medicare plan, which means finding one that includes your preferred doctors and your regular medications, helping you to avoid high out-of-network and out-of-pocket costs. Always ask questions of your doctors and your insurance company. Make sure you know what's covered and find out about your prescriptions. Get in the habit of asking, is there a less expensive option for your prescribed medications? With this Watching Your Wallet, I'm Rachel DePompa.
If you're looking for more investigative reporting on demand, download our streaming apps on Roku, Apple TV, and Amazon Fire TV. And that's it for us. Thanks for joining us here on Investigate TV. Hope to see you next week.